Artificial intelligence is quickly becoming one of the most powerful tools transforming how emergency departments operate. AI can help reduce wait times, speed up test results, and ease the stress on families and frontline staff.
So could AI truly change the ER experience at SickKids? Joining us live this morning with more on this is staff physician at the Hospital for Sick Children, plus co-lead at SickKids AI Service, Fatima Zaidi, co-chair of Tech and Biz for SickKids. Welcome to the show, both of you. Thanks so much for joining us to talk about this exciting new area for medicine using AI. I'll start with you, Devin. As a staff physician, I'm sure you've seen a lot. We both have kids. They've all been through SickKids. Great experience, by the way, but it's always the wait times. It's always how can we deliver better health care to our most vulnerable population. What inspired you to kind of say, hey, I want to look at AI and see how this can really improve services?
Yeah, absolutely. And you know what? It's really about listening to our patients, seeing their experiences in the emergency department. And exactly as you said, spot on. They want reduced wait times. They want to get to testing faster. They want to get to a diagnosis faster. And the reality is, if we accidentally leave the wrong patient waiting too long, sometimes you can have some tragic and really devastating outcomes. And so at SickKids, we've just said enough is enough. We're going to tackle wait times head on, and we're going to leverage this emerging technology such as artificial intelligence to do just that, keeping in mind responsibility, ethics, and being obsessed with patient safety along the way.
Yeah, we hear there's a lot of stories in the news of AI for bad. This is AI for good, very clearly. Fatima, you're talking about raising about $1 million for the hospital here. Why this goal? Why is it so important to to reach?
So Tech and Biz for SickKids are really a group of individuals. We're extremely passionate about tech and AI and how it can change lives in a very tangible way. With the previous success of our last campaign, Tech for SickKids, we raised $8 million to support innovation at the hospital. And so we decided to come back last year with Tech and Biz so we can continue to engage companies of all industries and sizes to support SickKids' latest campaign, which is Precision Child Health. And happy to speak to Precision Child Health so that folks can understand what really SickKids is trying to do, which is move away from their current model of care. It's really a one-size-fits-all approach to Precision Child Health, which really takes into account a child's unique signature health. In simple terms, it means every child that walks in gets treated based on their unique DNA and lived experience, which requires a lot of funding, but also allows us to become more proactive than reactive with child health care.
Yeah, I imagine that the more specific and targeted you get, the more effort has to go into that versus a generalization of, hey, you're 6 to 12 years old and this is your symptom, this is your whatever. Devin, maybe you can talk about where you're seeing some areas where we can kind of sooner rather than later see the innovations of AI helping with medicine, not just administrative stuff.
Yeah, absolutely. And so we're about to launch a clinical trial this summer, which is going to be really exciting. Essentially, when patients arrive to our emergency department, we capture triage data really quickly, usually within minutes after they arrive. We're able to use that data combined with responsible artificial intelligence to predict, might you have appendicitis and need an abdominal ultrasound? Might you have a broken bone and need an x-ray? And what we're proposing is why not just order those tests right away after you arrive? Get to a diagnosis faster, help AI get you to the treatment faster, and quite literally save lives along the way in the emergency department.
Just how exciting is this as a physician? I mean, I'm assuming when you went to medical school, AI was sort of something we saw in the movie plots rather than something that could be realistically deployed, in your line of work. This must be incredibly encouraging, exciting.
Yeah, I had no idea I would be doing this when I entered medical school. Ended up going into a master's of computer science, which was definitely not on the plan.
Wow.
And really, it was driven by our patients, seeing some tough patient outcomes in the emergency department and thinking we need to think bigger, we need to do better, and we need to find ways that we not only just solve this problem at SickKids, but how do we use technology to solve this problem across the world, scale our impact. And that's exactly what artificial intelligence is going to let us do.
Yeah.
Okay, speaking on the tech side, and maybe to play a bit of devil's advocate, if this is going to help reduce wait times, as you say, and kind of improve things, will any jobs be lost, or will this be kind of a fundamental add-on? And how quick can we see the results? How long does it actually take to implement this?
Yeah, I can jump into there.
Okay.
Really, from an emergency department perspective, we really need increased capacity, not only in Ontario, but across the country. And so this is really about having an AI sidekick, if you will, work alongside our clinicians, help to add capacity so that we can start to accelerate care forward and tackle those bottlenecks that is just related to capacity issues that we have. And yeah, go for it.
I was just going to say, we're really tight on time. I just want you to get that shout out in so people can contribute and find out where they can.
Yeah, absolutely. So SickKids is currently the #1 children's hospital in the world. In order to keep it at the standard it's at today, it is entirely reliant on government funding and private donations. Lots of ways you can get involved. You can become a monthly donor, a corporate sponsor, fundraise on behalf of SickKids. Early stage startups, there's a new way you can pledge your equity through Upside Foundation, which is a charity that allows early stage companies to pledge their equity to the hospital, or a charity of your choice, which is really great because at time of exit or sale, SickKids can see those funds come through.
Pretty
so
exciting.
I pledged my equity and really encourage the public and the community to get involved so that we can continue to keep SickKids at the standard it's at today.
Excellent.
Okay, exciting stuff. Fatima and Devin, thank you so
Thank you
much for
both.
joining
Good to
us.
see you.
So much.
Thanks for
Good to
having
see
us.
you.
We
How
appreciate it.
exciting.
It's nice to
Thank
see
you.
Thanks for all the support.